welcome. You're watching our special show, Long COVID Explained. We are having a conversation on what to expect after recovering from COVID-19, or rather after you are negative on RT-PCR, because you haven't recovered until the time you have fully recovered. Why are cases of long COVID flooding hospitals in India now? What exactly is long COVID, and what can you do to help yourself to prevent complications of long COVID? We talk about that up ahead on the show with an eminent panel of doctors and also a patient of long COVID. I'm Sneha Murdani. First up, India is seeing increasing cases of post-COVID symptoms, also known as long COVID. There are newer symptoms that recovered patients are reporting, and it is mounting a challenge for doctors who are still trying to understand the perils of COVID-19. They say the infection is here for a long haul. Here's more. Fatigued for months after recovery from COVID. Feel brain-fogged and zoned out all the time. Well, these are some common complaints that are coming in from people who are infected. Actor Malaika Arora is one of them.
I just feel nothing is happening. I just feel my body just refuses to respond to anything and everything. Yoga helped me later. During COVID, I was not able to do much. I was too weak to do anything, although they tell you, you should do a bit of breathing and all of that. I was in no condition because I was just too weak to do anything.
Bollywood star Bhumi Pednekar echoes Malaika's sentiments. She says, and I quote, "I feel like COVID has eaten up all my strength." But doctors are not surprised. They have warned that COVID-19 has a lingering impact. It puts patients at risk long after the virus has left the body.
With my digestion, I think a lot of elimination of certain food products and groups is what I'm trying to do now. I've taken some dietitian's advice and I'm working it on in my routine. But I really don't know what's going on. I know that I'm not 100%, and I might take a long while to get better and feel my 100% again.
In fact, COVID is leaving no organ untouched in the body. The Indian Council of Medical Research says if a person has symptoms 4 to 12 weeks after testing negative for COVID, it should be treated as a post-COVID syndrome. If after 12 weeks symptoms continue, the patient should go for an RT-PCR test. If positive, it means they have been reinfected. But if negative, it should be treated as long COVID.
Even after coming back from hospital, the problem was that breathlessness remained. Even going from one room to another room was a problem. Secondly, all the memories were vertical. There was no coherent correlation between one memory to another. So, for example, if I'm reading a newspaper and there is something in that, then I will not be able to relate to whether I was having a tea or where I was sitting.
Patients with these long COVID presents with various symptoms. They can come to you with cognitive difficulties, which is called as brain fog. Patients may have anxiety, they may have depression, they may have tingling, numbness, they may have loss of taste and smell, which is persistent for a very long time. There can be persistent fever, sore throat, dry cough.
Doctors say more severe symptoms might also mean post-COVID thrombosis.
There are some blood tests which can be done, like D-dimer, to see whether there is any susceptibility to develop clotting in their vascular system. In those patients, they have to take certain drugs which are called anticoagulant drugs for a period of 3-4 weeks to prevent the attack of what we call thrombosis or deep vein thrombosis or pulmonary embolism or such type of diseases.
Secondary infections also make recovered COVID patients more vulnerable.
The 4 most common complications in the lungs of the patients who recovered from COVID that we encounter are, first of all, secondary infections. These secondary infections could be viral in origin, could be because of certain bacteria, especially the drug-resistant ones. They could be because of tuberculosis or due to fungal infections. Fungal, we all know, could be aspergillus or mucormycosis. Mucormycosis is also being labeled as black fungus, which is a misnomer actually.
Doctors in Delhi say they are seeing 25 to 30 patients on a daily basis who have post-COVID complications. From fever to lung fibrosis, the complications are leaving doctors flummoxed. Studies suggest that even asymptomatic patients are developing long COVID. Well, doctors advise caution. Plan, prioritize and not get back to work aggressively. That's the word of caution. Well, after recovery, still follow COVID-appropriate behavior and avoid crowds. Listen to your body and take help when needed. Sleep hygiene is important. Good nutrition and deep breathing may help you. In some cases, physiotherapy also helps. Clearly, the infection has a long haul. With inputs from Sonali Acharji, Sneha Mordani in Delhi for India Today. And joining us now are Dr. Vivek Nangia, Principal Director and Head Pulmonology, Max Healthcare. Dr. Atul Gogia is a Senior Consultant, Department of Internal Medicine, Sir Gangaram Hospital. And Rohit Raghavan is a patient of long COVID. Thank you all for joining here. Thank you all for your time. Dr. Vivek Nangia, I want to begin by asking you if you just do a brief comparison with what you saw in the first wave of the pandemic and what you're seeing in the second wave. Would you say that the number of patients coming to you for long COVID has gone up drastically?
So thank you, Sneha, for asking me this question. I would certainly agree with you that the number of patients has gone up drastically as compared to the last wave. But that's also because the number of patients per se has been very large. You know, the quantum of patients that we saw this time as compared to the last wave is significantly higher. Even if you look at the difference between the two peaks, one is here and the other one is here. So, you know, obviously the long COVID syndrome patients would also be definitely larger in number. But yes, what we are also seeing is that the symptoms are continuing to persist for a prolonged period this time. Not only are the numbers gone up, but even the duration of illness has gone higher.
Okay. You know, you mentioned the duration. Dr. Atul Gogia, I understand that cases will go up because overall cases have gone up. But what about the duration? Why are people taking so much time to recover even in long COVID?
Yeah, that's really very interesting things which is happening this time around the corner. The earlier wave, as Dr. Nangia had rightly highlighted, the numbers were less, but the numbers are high. But probably the strain this time is different because these patients are taking a lot of a long time to recover. So people who got infected in April, they're still struggling with COVID-like symptoms, post-COVID symptoms. So probably it is the mutant strain which is causing this because the symptoms are going on. It's been 2 months or so when people have been infected and they're still struggling to get out of it completely.
Okay. All right. I'm just going to also bring in our guest, Rohit Raghavan. He is a patient of long COVID. Rohit, just tell us, how old are you and what have you been going through? When did you actually recover? And by recover, I mean, when was your RT-PCR test negative and what have you been facing?
First of all, good evening to everyone. And I am 36-year-old. And thing is that I'm still recovering. I'm not said that that I'm recovered. I'm still recovering, and this phase is. Sometimes I'm really confused. Sometimes, someday I feel very energetic. I feel very high, but in some morning I feel very low. You know, I don't know. I don't know what happened, and I cannot explain. Means what's happening inside, I don't know because I'm not a doctor. But some morning is very confusing. Like I cannot explain myself.
Okay.
Means I feeling chest tightness in my chest. I cannot breathe properly. Sometimes even it happened around. I was discharged in May, and now it's June, and it's been around 1.5 months, and I'm still struggling with my health.
Okay, you're still struggling with your health. Dr. Vivek Nangia, you're hearing that often from people who say that we're constantly fatigued, even just like, you know, moving from one room to another just leaves us fatigued. What are the most common symptoms of long COVID that you are seeing in patients?
So basically, you know, I was just trying to recollect that there was one study which has been published from the US, which has shown that 25% of the people suffering with COVID illness would develop a long COVID. So if we were to look at the numbers, out of 3 crore people or 4 crore people who got affected with COVID so far in our country, you would expect 1 crore to be coming down with long COVID. Now, as far as the symptoms that we see in our country, they're predominantly fatigue, body aches, fever, sore throat, breathlessness, joint pains, and then going on to all these symptoms related to the neurological system, which include loss of memory, lapses in concentration, unable to concentrate, unable to comprehend at times, brain fog, as we commonly call it. These are the most common symptoms that we are encountering here these days.
Dr. Nangia, would you agree with Dr. Atul, who seems to be suggesting that there is a possibility that the duration of long COVID is just extending even further, and there could be a link with the variant which is dominant in India, which is the Delta variant? Do you think that that is one area that the governments and scientists need to look at right now?
So definitely, even if you look at listen to the WHO chief's statements, she said very clearly that this Delta variant is definitely more virulent. It also has a higher R naught. So where the R naught of the previous virus was about 2, 2.5, this time it's probably touching 3 to 4. So that is the reason why the numbers went up so much, and also because this was definitely a more virulent strain as compared to the last time.
All right, Rohit, tell us about your experience as a COVID patient. How severe was your infection? Because, and I want to talk about that also, because a lot is being said and studies seem to be suggesting that even asymptomatic patients are in fact having long COVID. I'll bring in the doctors on that. But Rohit, first your experience with COVID-19. Did you get severe COVID-19? How was your condition?
Ma'am, actually my score, that city score was 11 out of 25. And I had gone through this CT scan on 24th of April, and I admitted on hospital 28th of April.
Okay.
And the day of my admission, I was severely, I cannot breathe at that time.
Okay.
And I don't remember much because my whole concentration was to breathe. That I have to breathe only. I don't think about anything.
All right. Dr. Atul, in your experience, are you seeing children also with long COVID coming to you, especially I'm talking in the context of the second wave particularly?
That is a pertinent question actually, but I am not directly dealing with pediatric patients, but we are seeing pediatric patients also having a lot of problems this time round the corner. So as we had in the last wave, the pediatric population was largely unaffected. But this time round the corner, so pediatric people, kids are also having a lot of complications, lot of prolonged symptoms, lot of prolonged fever, as Dr. Nangia highlighted, a lot of symptoms which are persisting. So fogging, fever, weakness, which we are seeing in the adult population. The children are also having the multi-system involvement. It's just not the pulmonary system, but it is affecting the whole body. So this time round, a whole lot of things are happening which are very, very sinister as compared to the last one. If you see, the numbers are also high and the complication rate also has been higher this time round.
Dr. Vivek Nangia, what are the most common symptoms of long COVID that you are seeing? And also I want to ask you that a lot has been said about brain fog. This certainly is a neurological problem, and let's begin having a conversation about what can patients of COVID-19 now do really to help bring themselves some relief as far as these symptoms of long COVID is concerned. What should they really be watching out for, and what should they do from here on?
So basically, unfortunately, there is no way you can predict or prevent the development of long COVID. There's no way one can say that who will develop, who will not develop. Although the studies from US and UK have shown that it's mainly happening in people from 30 to 60 years of age group. More common in women, although it's just about 5% higher in women. But yes, it is certainly more common in women, especially of the white race. But other than that, there's no way of predicting it. Yes, people who've had a prolonged stay in the hospital, required ICU care, there's a greater probability, 50% chance that they would have a higher probability of developing long COVID symptoms.
Right.
But even mildly symptomatic and the asymptomatic patients also can develop long COVID. So basically, unfortunately, as I said, there's no way of protecting yourself or preventing yourself, but certainly you can keep yourself healthy by one, consulting the doctor immediately as soon as you feel there's a symptom like that developing. Because quite often, if not very commonly, what we're also seeing is that people going into a multi-system inflammatory syndrome, MIS in adults as well, which is earlier seen only in children, but
Okay.
now we've seen that in the adults also, the multi-organ inflammatory syndrome. So therefore, it is very important to consult your physician as soon as you feel unwell in the post-COVID period.
Okay. You know,
Same
Dr.
thing is-
Nangia, you mentioned an important point because, I did not know about this, and I'm sure a lot of viewers would want to know. The government has also put out a series of suggestions on what to do if you suspect an MISC patient in your family. Of course, it's going to be a child is what the general understanding is, since there is some information on what MISC is. But MISC in adults, how frequent is that problem right now?
It is not very frequent, as I said. It's still very uncommon. But yes, we have seen a couple of patients lining up with us in MISA. In MISA, what you need to watch out for is primarily breathlessness, conjunctivitis, loose motions, diarrhea, and skin changes. Those are the four most common symptoms that you see, along with fever. So if you have any of these as a constellation together, then it's always best to reach the hospital as quickly as possible and not delay it. Drop in oxygen levels, breathlessness are two other symptoms that you need to watch out for at all times, and consult your physician as quickly as possible.
Okay. Dr. Atul Gogia, a lot of people, and in fact, I know a lot of people who just recover from COVID and have this understanding that, okay, we are not going to get reinfected, not at least anytime soon. We have some amount of immunity, and they try and go about their lives like business as usual. What would you tell these patients who just recover and then step out, get back to work, sometimes even aggressively? Would you advise against it? Tell us more.
Yeah, that is again very, very important thing which we need to discuss is that a lot of people and all of people feel that, generally that 2 weeks period is over and we are out of it and we are out of woods. That was the general feeling with most of the people had that, once we are COVID, RT-PCR, people are doing it and it's negative, or, 2 weeks are over, I'm out. So it is not like that. We have seen that this long COVID is there, it's happening, and quite a lot of people are having it. So we need to be cautious, alert about all this, all the points which have been highlighted by Dr. Nangia. We should be aware that these things are there. So anybody who has symptoms should be alert. Watch for symptoms. Do not going back to work, right? But you should take it easy. You should not, start severe aggressive running, walking. These aggressive movements initially in the post-COVID period should be avoided. We can do routine work, desk job, sitting job, that's fine. But something which involves a lot of running around or a lot of exertion should be avoided immediately, especially 6 to 8 weeks, up to 3 months. We should avoid, strenuous exercise. So we should be cautious about these things. Watch for symptoms. Do not panic. That's also important. That we have become everybody is getting a test done every week. People are doing their CRPs and dimers, and nobody knows how to interpret them. So we have to consult and be in touch with your physician if the symptoms are there, recurrence of symptoms is there, or persistence of symptom is there. So symptoms like fever, breathlessness, exertion, breathlessness on exertion, palpitations, these are quite common symptoms. But if they are persistently there, you should get in touch with your physician.
Yes.
Getting back to work, I just said that, you can do your routine work, but overexertion should be avoided immediately after getting out of things.
Yes, Dr. Vivek Nangia, Dr. Atul mentioned the dimer test. I want to ask you, a lot of patients are in fact having complications because of thrombosis, also succumbing because of it. What would you suggest then? When should the dimer test be done? And what is the way to then avoid a situation like a thrombosis? Also, like I said, it's being seen even in the younger patients right now. And correct me if I'm wrong.
Well, you're absolutely right, Sneha. But there has been a lot of fog around D-dimer also. Like patients suffering with brain fog, there's been a lot of fog around D-dimer and its interpretation and its values. That what is the true representation of D-dimer. See, basically we need to remember that D-dimer is a marker which could be increased even in the presence of an inflammation in the blood vessels. That is why it is also linked to the thrombosis. It has a negative predictive value, meaning thereby that if the D dimer is negative, that means the likelihood of thrombosis is low. But if the D dimer is high, that does not mean that there's an increased likelihood of thrombosis. It just be related to inflammation also. We've had so many patients where the D dimer levels were 10,000, 30,000, 60,000 also, as high as that. And we've got their pulmonary angiograms done and DVD profile done and did not find any evidence of thrombosis at all in these patients. There are various studies now which have been conducted across the globe and have shown that D dimer value is not to be relied on very much as far as giving the blood thinners is concerned. D dimer value indicates two things, that one, there may be a possibility of a clot being there, and two, that it could just be an inflammation inside the blood vessels also.
All right.
So it's on the D dimer value. If you start patients on blood thinners, it could be counterproductive and could result in increased bleeding disorders as well. Therefore, D dimer value is to be interpreted very, very cautiously and very carefully, and only by the doctors and not by the patients themselves.
Okay. Rohit Raghavan, coming to you, taking off from the point about how you just would go about your life, just tell us, what are you doing to help your situation, given the fact that you have been told by doctors that it's going to take a while for you to recover? Are you home right now? What is it that you're trying to... Yes, tell us more.
Yeah, ma'am. Right now I am home. Right now, means after discharge from hospital, I am just doing whatever I have been told by my doctor. And as per my doctor, whatever just now Dr. Saab explained, I'm doing the same thing. I'm not putting extra pressure on my head or on my body. But yes, sometimes I feel anxiety that when these all things will be over, because everyone is saying this is a new illness. We don't know much about it. We are just guessing that this will happen, that will happen. So regarding this, yes, I have my anxieties, but right now I'm not doing extra, any work or any exercise. I'm just taking rest and normal routine. Normal routine is
taking it easy. Dr. Atul Gogia, an important question I want to ask you, and this has got to do with our nutrition, because that plays an important role in recovery. Do touch upon what should patients who are recovering from COVID should look at in terms of the kind of food that they consume, essentially to help recovery, and also to ensure that the process of recovery eventually, even from long COVID, is smoother.
Yeah, that is very, very relevant. Nutrition is an important part of recovery of any illness. That is most important part, especially in the vulnerable age group like children and the elderly. So we have to be very important thing is to ensure that there is no dehydration. So they are very well hydrated, because dehydration is another risk factor for thrombosis. So adequate hydration is very, very important. So adequate liquid intake. Obviously, you have to consider your cardiac and renal function status by being in touch with your doctor. So adequate hydration. Along with that, a good nutritious diet, a balanced diet, which includes protein intake as well as vegetables and fruits, which has to be balanced and taken appropriately. We should not be just blindly taking supplements and oral supplements. We should be in touch with the doctor. And I feel adequate hydration with protein intake, with egg intake, and things like vegetables and fruit intake should help us rather than taking just supplements.
Dr. Vivek, I want to ask you about what if, a patient of COVID-19 who's recovered is not really having symptoms of long COVID, or very serious symptoms, I would say, with the common ones like fatigue, for example, sleeplessness. How often should you be consulting a doctor? Should you be doing it every 3 months so that you're just keeping everything in check, a full body checkup? Is that something that you would suggest?
So basically, there's no recommendation as such to be doing a full body checkup. Ultimately, we have to go by the symptoms. There are people who are getting their CRPs done, D-dimers done every week, every fortnight. but I see no value in that because unless there are symptoms, you will not treat them. Those markers which need to be treated, I mean, the markers don't have to be treated, but the patient has to be treated. The symptoms or the illness has to be treated. So actually, no role of getting these markers done unless there are the relevant symptoms as well. And symptoms, as I said, what you need to watch out for are persistent pain, fatigue, breathlessness, drop in oxygen levels, fever. Those are the things that you need to watch out for and reach out to your physicians as quickly as possible if any of these develop.
All right. Thank you so much, Dr. Vivek Nange. I'm going to thank Dr. Atul Gogia also, as well as Rohit Raghavan, for joining us and, sharing your experience with us and telling you what to expect then in days and weeks to come. If you are a patient of COVID-19, there is a possibility that you could be suffering from long COVID, or you might just suffer from long COVID, and that can just last up to months together. So it's important for you to know, in fact, what to do in terms of the kind of exercises and also your nutrition. Everything has to be taken care of. Thank you all. Well, that's it from me for the moment. News and updates continue on the other side of this break. Thanks for watching.